I mean, I think the sense is, I mean, the sky's the limit, and what's limiting us right now is just giving patients good access to their data that they can then use to be engaged in however they want to be engaged. I think another key issue that came up on the panel was that it's not going to be the same for every patient. Some patients maybe want a more paternalistic, doc, tell me what to do, and there are going to be other patients that really want to be at the center of that decision making and use, online decision tools. And so I think what was exciting was hearing about sort of what was possible, but then also trying to figure out how do we move the healthcare delivery system and sort of then all of the other players that are going to be part of this to offer patients what they want. So we did spend a lot of time just talking about getting, how do patients get access to their data? But then the second part of the conversation is, I think we all assume that will happen, hopefully in the near future. How do we then really take that data and use it to engage patients? And I think there's a huge amount of opportunity for the healthcare delivery system to do that, and I think that my concern is that it's not really a challenge that they have wanted to take on. Patient engagement has not been really a focus of our healthcare delivery system, and I think what we're seeing is that people are just frustrated with how little that's happened, and what we're seeing is that there's sort of an assumption that you're going to need to work around the traditional healthcare system and really get patients access to their own data and give them the ability to sort of manage and make decisions around and outside of the healthcare system. And I think that's really risky because at some point you're going to need to plug back into the healthcare system. And so how can you imagine a world of patient engagement in which they're doing it sort of really outside of doctors and hospitals and the other settings where they need to get that care. So it was, I think it's both an exciting time in which there's a lot of opportunity and a lot of change, but also a time when we really need to, I think carefully about who are going to be the actors that are leading this, who's going to get pulled along, and who might get left behind. And then at the end of this, do we really come out ahead, and do patients feel like they're getting the care and support they need, and sort of using tools and technologies really is a support to that, right? The technology is not going to be the driving factor, it's going to be the supporting factor. And so what we really have to think about is what are the models in which we support patients, and then think about what's the role of technology.